안녕하십니까.
Greetings, I'm Professor Lee Jun-seop of Prosthodontics Division at Dankook Dental University. Today I'm going to talk about posterior prosthesis design. As shown, we frequently come across the posterior crown, therefore it has a very familiar design. There are factors that we can easily overlook because of this. However, this is very important and there are principles that we need to stick by. Today, I would like to revisit these principles. The contents of the day. First, I will talk about the form of prosthesis like the form of margin, proximal contact, and the impact of subgingival design. After that, I'm going to look at clinical proposal before finishing. Let's look at factors to be considered in determining crown design in posterior area. The important factors that need to be considered in determining posterior design are as shown. First, mesiodistal and buccolingual width determines the size of the crown. We also need to consider the antagonist, the form of marginal ridge, and proximal contact size and position. Cervical embrasure form. These are all very important factors to consider. Let's look at mesiodistal width and buccolingual width, which determines the size of the crown. As shown, the mesiodistal width is set as the face with adjacent tooth, except when we need to adjust the form of adjacent tooth in the future. It should be in tight contact with the adjacent tooth on both sides. From a occlusal view, the buccolingual width should be in balance with the contour of adjacent teeth, and occlusal table should be in balance with the adjacent tooth's bucco-occlusal line angle and lingual-occlusal line angle. At times, in the case of implant crown, you can make occlusal table 80% of that of natural tooth. Let me show you a case. Prosthesis is made like this. When you make a decision like this, you can see that the occlusal line angle between adjacent tooth and implanted prosthesis are not aligned. If posterior prosthesis is fabricated like this, it can lead to food impaction or discomfort. There can be reduced efficiency of mastication, such as cheek biting. If you look at this case, this can be an exception. You can see that bucco-occlusal line angle is not in balance with adjacent tooth. It's slightly buccally inclined. However, if you look at the antagonist, it is also buccally inclined. In this case, you need to consider the antagonist position first. If you ignore this, the patient may bite on tongue or buccomucosal linea alba. Next, let's talk about the height and position of marginal ridge. The height of marginal ridge should be the same as adjacent to tooth. The angle and contour of marginal tooth should also be in symmetry with that of adjacent tooth. Please look at this image and diagram. From occlusal table, the height and contour are aligned. The buccal and lingual embrasure should be in the form of isosceles triangle. In the image, the size of buccal and lingual embrasure is different. However, it has symmetrical structure in the form of isosceles triangle. This needs to be considered very accurately. Marginal ridge prevents food impaction and it also serves as food escapeway. If we fail in providing this, food impaction occurs. If you look at the buccal view, the mesial side of the mesial tooth, there's a spacing, and on the distal adjacent tooth, it is mesially tilted. In this case, if you form a marginal ridge in line with adjacent teeth, if the mesial tooth shifts mesially, there will be spacing and it will lead to disparity with the marginal ridge. And if the distal marginal ridge, because the distal tooth is mesially tilted, the marginal ridge may not be aligned with the adjacent teeth as well. In this case, both on the mesial and distal side, due to wedging effect, the food impaction can occur. Despite the tight contact, we can see cases where food impaction occurs very frequently. In this case, we need to alert the patient of such possibility ahead, or you may need to restore the proximal contact with adjacent teeth, and even if you reduce the occlusal surface, the distal marginal ridge needs to be aligned. Let's look at the next case. As shown in the top, it is very important to fabricate prosthesis aligning the marginal ridge, and this is completed through lab process. If you look at the lower left case, the marginal ridge height is different and the embrasure form seems very unfavorable. If you look at lower right case, the marginal ridge contour are aligned, but it is formed slightly high. In the lab process on the model, it's very difficult to detect this. Therefore, clinically, when we do try-in the oral cavity, we need to pay attention to this. Therefore, in all cases, contour and height needs to be aligned. If you look at lower left, the green line shows how much misaligned the marginal ridge is. In the end, this needs to be adjusted as shown in lower right. Only in this way will we be able to prevent the food impaction and provide a food escapeway. Next, I'm going to talk about proximal contact. I'm going to talk about the forms that we know morphologically. The form of proximal contact from anterior area to posterior area, it becomes longer to more buccolingually long. And the buccolingual position of proximal contact in premolar, it is in between the buccal third and middle third. However, this moves towards middle third in the posterior area. The proximal contact height should be in between the middle third and occlusal third in such border. This is the morphologically ideal form. Although we try to stick to these principles, clinically speaking, we see cases that really do not. Due to proximal wear, it gradually moves towards the occlusal table. Ideal proximal contact in tooth is known as point contact, but clinically speaking, you need to make it similar to the proximal contact of adjacent tooth and position. Point contact Even though if it is tight, a lot of patients complain of food impaction as shown in this image. It is more stable to provide a straight surface contact.
것이 훨씬 더 안정적이라고 할 수가 있겠습니다. 자,
Please take a look at this case.
잘 봐주시기 바랍니다.
You can see that
근심
the proximal contact mesially and distally, the form are different.
전남을 알 수가 있습니다.
This is because the proximal contact of the mesial and distal tooth are different.
것이고
The proximal contact should be in balance with the proximal contact of adjacent teeth.
좋은 접촉면이라고 할 수가 있을 것입니다. 그것의
If you do that, you notice that the buccal and lingual embrasure are symmetrical and balanced embrasures are formed.
형태의 엠브레이저 또한 형성이 되게 됩니다.
In this way, you'll be able to provide a prosthesis with maximum comfort.
합니다. 자, 이제
Now let's move on to emergence angle and connector design.
커넥터
Let's look at what kind of connector design there are.
보도록 하겠습니다. 자, 엠브레이저의 형태는
Embrasure form in natural tooth should be in symmetrical isosceles triangle shape. However, implant has smaller diameter compared with natural tooth, therefore the triangle becomes fuller.
보다는 더 풍요한 삼각형이 될 수밖에는 없습니다. 또 이 부분은
Also, it rarely fills up with gingiva, so space maintenance is very important.
가 굉장히 중요하게 됩니다.
Ultimately, in this area, food impaction is bound to occur and careful maintenance is imperative.
이 음식물
Frequently, we see attempts to block the space by increasing the contour. However, if you use this method, it stresses the gingiva and it can lead to inflammation.
발하게 되는 경우들이 많습니다. 실제로
If pressure is applied, such inflammation can result.
하게 됩니다.
In the past, such over-contour was deemed good and this was being lectured. However, now it is considered as contraindication. Now let's move on to emergence angle.
보도록 하겠습니다.
The most frequently used implant is TS-type conical seal type. In the past, emergence angle was mentioned in terms of anterior aesthetics.
와 연관돼서 거론이 되었었습니다. 그렇지만
However, these days, emergence angle in the posterior area are emphasized as well.
그 이유는 바로
This is because of the characteristic of TS-type implant.
TS 타입의 임플란트는
Even if the diameter of the implant increases,
항상
abutment comes off from a diameter 2.5 millimeter size hole. Even if the diameter is the same, depending on the abutment height and gingival height, the emergence angle changes.
이머전스 앵글이
If you look at this diagram, the recommendation is below 30 degrees of emergence angle,
30도 이하로
and it is recommended not to use those with over 40 degrees.
사용하지 말라고 권장을 하고 있습니다. 그렇게 봤을 때
If the gingival thickness is 3 millimeter, if you use 7 millimeter abutment, this is 45 degrees, so it is not an ideal abutment.
그렇게 좋은 어버트먼트가 아닐 수 있습니다. 또한
When you use 5.0 diameter abutment, if the gingival thickness changes from 3 millimeters to 2 millimeters to 1 millimeter,
동일한
even if you use the same 5.0 diameter abutment, the emergence angle changes to 25 degrees, 35 degrees, and 50 degrees.
바뀌게 됩니다.
In this case, if the acceptable scope of emergence angle is exceeded, rather than using subgingival prosthesis, you need to use either supragingival prosthesis or thin abutment. As shown in the upper right image, such prosthesis was recommended in the old days. However, in that case, the possibility of peri-implantitis goes up. Therefore, this is not recommended. You can see in the lower right, there's continuous bleeding. Periodontal treatment was provided, but bleeding and swelling could not be stopped. When I removed the prosthesis, such inflammation was observed. When I removed it, the emergence angle of the abutment was on the buccal side 60 degrees and on the lingual side 43 degrees. When I reduced the emergence angle, you can see the improvements in upper and lower left images. You can see that gingival healing has occurred. In posterior area, changing emergence angle can lead to reduction in gingival inflammation. This is a very important factor. In the upper, in a lot of cases, there is sufficient gingiva. However, in the lower, there are cases where we cannot place implants deep and where gingiva is thin. In this case, in order to get aesthetic result, if we provide subgingival prosthesis, emergence angle can be over-contoured. In this case, because it is posterior area, you need to explain well to the patient, provide supragingival prosthesis, and form embrasure. This is the kind of prosthesis design where maintenance can be done and inflammation prevention can be done. Next, I'm going to talk about connector design. As shown in the diagram, there are multiple designs. If you look at the facet of the connector, it is very different from left to right. On the case of left, the characteristics you see is a thin and long path. The second, the interdental zone is shaped like a tunnel, which is long and has sufficient height. Third is like a very tall tunnel. And the last is short and small tunnel. In terms of design, preventing food impaction is very important, but also we need to make self-cleansing possible and you need to make the food escape easily. Such design needs to be applied in the connector area as well. What is on the left, unless the patient uses interdental brush, it is a kind of design where the food cannot escape easily. The design on the right, if maintenance is done well with just a toothbrush, food impaction will be controlled. There can be different connector designs. If you look at the image on top, the connector area is too filled up, therefore self-cleansing was not possible and inflammation continued to occur. If you look at lower right, the prosthesis, the connector area is covered. In this case, the patient may not complain of food impaction, but the patient will not be able to maintain food retained in that area and it can lead to further problems. In the case of lower right, the patient needs to use a thick interdental brush for maintenance.
디자인이라고 할 수가 있겠습니다. 그래서
It is very important to maintain the interdental zone.
그래서 만약에
As shown in the left image, if it is difficult to control the interdental zone,
어려운 것이라면 그럴
rather than designing a splint, you need to split the prosthesis so that maintenance can be done properly.
부위를 잘 관리할 수 있도록
The patient should be able to use the floss. Fabricating prostheses separately could be a better design for preventing implantitis.
자, 요약하자
I'm now going to summarize. In fabricating prosthesis,
면의 형태
the occlusal table, marginal ridge form, proximal contact, position, and
등이
form needs to be considered. In the case of TS-type implant, even in posterior area, it is not recommended to provide over 30 degrees of emergence angle.
그리고
The interdental zone. Food impaction should be prevented ideally, but if this is not possible, we need to make a design where food escape is easy.
또한
In the case of lower posterior, if the gingiva is thin, in order to prevent over-contour of emergence angle,
것을 막기 위해서 치은
supragingival margin is recommended.
그런 것
If this is uncanny, SS-type or US-type implant are recommended.
추천을 드립니다. 마지막
Last but not least,
형태가
connector area
할 수가 없고
should be designed so that the patient and dentist can control it. If this is not possible, rather than bridge form, split form should be provided.
네,
Today, I talked about the prosthesis design for posterior implants.
알아봤습니다.
I was not able to address all the factors or areas related to posterior implant design. However, this should be convenient, functional, and easy to maintain.
수한 디자인을
I hope you provide optimum procedures with functionally ideal designs and continue to build upon your clinical experiences.
이만 인사드리겠습니다.
Thank you for watching.
감사합니다.